Understanding pain and how to think about pain differently in under 10 minutes. Everyone experiences pain at some time in their life, and you may be surprised to hear that in the UK, long-term pain is common, with 1 in 5 people experiencing pain for 3 months or more. The feeling of pain occurs to protect us and help our bodies to mend itself, and it can be described in different ways by different people. Commonly used words might be sharp, dull, achy, but some people may use words linked to their pain, like isolating, or emotive words like anger and guilt. And this is because the experience of pain is unique to the individual. You may have heard that the brain is responsible for making us know that we're experiencing pain, and pain can last a few seconds, minutes, hours, days, weeks, months, or even for years. To describe pain, we put it in 2 different groups: acute and chronic. Chronic simply means the pain is long-term, and you may also hear it called persistent pain. Acute pain normally happens because of an injury or damage to the body, for example, a cut or a sprained ankle. This kind of pain normally lasts for less than 12 weeks. Long-term pain lasts for more than 3 months. Past the normal healing period is over, and so the pain is considered to have lost its purpose of mending or protecting us. Having a brain that continues to send pain messages after your body has recovered from injury, or even if there was no injury in the first place, is not fun and can be exhausting, frustrating, and really affect how you live your life and your relationships. When we experience persistent pain, it's understandable to think there must be something not quite right. However, we know that most injuries to the body will have healed within 3 months. Once we know there is no threat causing the pain, and we consider that the brain may be being overprotective, it can be helpful to start to think about how best to manage the pain that you are experiencing differently or more holistically, which means treating the whole person and taking into account physical, emotional, social, and environmental factors, rather than just the symptoms of the pain. And although it may be hard to hear, you may need to reach a point of acceptance that you may live with some degree of pain, not entirely recover from the pain, or that it can't be passed over to a healthcare professional to fix, for example, by pain medications, injection, or an operation. You may need to consider that you might not be the person you were before you had long-term pain, or do all the things you used to do, but that you can make changes in your life and have a fulfilled life, even if you are a slightly different version of you. So where to start? It can be helpful to begin by looking at all aspects of your life and identify areas that you can make changes to, so you can better manage the pain, suffer from it less, and have an acceptable quality of life. It may be also helpful to think about what was happening in your life at the time when you first start to experience pain. Some people will recall that they were having some personal difficulties at the time. Thinking back to the first time a person experienced pain can be upsetting, but for some people it can also help soothe, heal, and move forward. It's also key to think about what's important to you. Modern life is often not the healthiest and can make your pain experience worse. Looking at your lifestyle choices can be key to managing your pain differently. Generally, following a healthy diet, keeping hydrated, limiting alcohol, not smoking, keeping active, and sleeping well are shown to be useful in helping reduce pain levels and recovering to various degrees from persistent pain. Reflecting on your life and reaching this point of readiness to make lifestyle and behaviour changes, alongside setting some personal goals, can make you feel healthier and fitter. Additionally, looking at your own thoughts and emotions, whether you are sad, scared, angry, and happy, will be helpful. Many people have noticed that their emotions and thoughts affect their pain levels. And this is not surprising, as your thoughts and emotions will be processed in your brain as well as your pain. So it's only natural they will affect each other. If people are relaxed, not worried, not upset, then the pain messages are reduced. The volume is turned down. If you are upset, angry, and stressed, the pain messages are increased. The volume can be turned up. It's possible to learn ways to manage difficult thoughts and emotions, and this will help change the experience of pain. Let's also talk about pain relief medications and how doing things that are important to you is more helpful to you than they may be. Many people who experience persistent pain will be taking pain medications to try and help with their pain. However, we now know that the effect of taking pain relief medications is limited. Taking pain medicines for a short period can be helpful at the beginning to help you get by, but over a longer period of time, we now know that pain medications become less effective or stop working. They can also have some risk associated, and they can have unpleasant side effects. Therefore, pain relief medications may be better used for pain flare-up days, rather being the only answer to persistent pain. Before we move on, it's worth mentioning that being physically active and moving more can be really effective in reducing pain, improving your mood and supporting emotional well-being, when done in ways that meet your needs and that are comfortable and safe. So, what we know is that long-term pain is real and unique to the person experiencing it, and that it is affected by lifestyle choices and where we live, work and play, as well as your values and beliefs. That to manage pain holistically, we need to look at ourselves as a whole and unique person and not as a machine with individual parts to fix. We know pain is produced in the brain, how we feel it is affected by lots of things going on in our lives, and that there are ways to manage pain and recover to some extent and live better with it. What stands out is that it is important to look at everything that affects you and your pain and what can be done alongside or instead of pain medications and support from healthcare professionals to ensure the best chance of managing pain, suffering less, living a meaningful life and accomplishing the things you want to. If we end by thinking of pain as a runaway bus, consider if you want to be the passenger with the pain at the wheel in charge of the bus, which is out of control and driving everything that happens to you. Or do you want to plan to take back control and drive the bus yourself? Have a roadmap for where you're going, be equipped with life skills to deal with difficult passengers, and have a toolbox to fix a puncture, with pain only as the passenger. Yes, the pain might still be there, but it's at the back of the bus and is no longer dominating your day and in control of your life. Thank you for taking time to listen and starting to think about how it's possible to manage pain more holistically.